one thing that wasn't addressed is conscientious objection of healthcare workers. Because when I see euthanasia and the abortion issue in oncology and cancer care, I'm afraid that I'm going to lose my freedom. And also, I would like to say that rationing is occurring now in healthcare. I was in Washington last week with some colleagues, and we met with CMS, and basically what they said was that we're rearranging the chairs on the Titanic. Their hands are tied. And in cancer care, we have Avalere did a study this year. This year, we are getting 55% reimbursement for the care that we're giving. Community-based practices, which are like small businesses, and especially in these rural communities, are going to have to close the doors. Sometimes, in some states, they are closing their doors, and in some places, we can no longer afford to give the chemotherapy in our offices, and the hospitals won't do it either because they're getting Medicare reimbursement reductions, and so some of our patients are traveling hours for their care.
Okay, thank you for that excellent question. I can answer the first one. One of the initial acts of the Obama administration was to repeal the conscience rule, which President Bush had put in place to protect healthcare workers who do not want to do things against their conscience, such as participate in abortion and euthanasia. The Obama administration repealed that rule. So there will be no protection for conscience under anything that's passed by the Obama administration. As to the second part of your question.
As President Morgan Right to Life, I've been very much involved in the fight against the destruction of the conscience protection, and that's a real problem. I was talking to one of my colleagues and said as long as I was going to prison with him, it'd be okay if we could share a cell. If that happens, if FOCA happens especially, this is going to be a real tragedy, but we are losing conscience protection in this country. There's going to be freedom of choice, but only if you choose the way the government wants you to choose. The other thing is, yes, there is rationing. Medicare is full of rationing. Just what Dr. Huntoon said earlier.